Imagine you wake up tomorrow and you discover you have malaria, and you walk to the nearest CHIP compound or health center close by, and you are examined, tested, and treated, and you are given your medication without being asked whether you have an insurance card or not, and you walk home. For millions of Ghanaians, including you who are watching, this sounds too good to be true. The government of Ghana has brought on board free primary health care, and this seeks to make essential primary health care free for the average Ghanaian. And this seeks to this is a push in helping Ghana achieve universal health coverage. The question that must be asked is that, is this the answer to our healthcare problems? Or this is another well-intentioned policy which will fail due to lack of funds and lack of proper implementation? Today, we are here to discuss the free primary healthcare policy which has been brought to light by the current government of Ghana. And I'm here to do that with
Kabnache.
First of all, I think our audience would like to know what exactly free primary healthcare is.
Yeah. So first of all, primary health care, let's even do that without even the free.
Okay.
Primary health care, that's the first contact or initial stage of every healthcare anyone is going to get. So the very first stage of you entering a hospital, a CHIP compound, a health center, being registered, going through for your vitals, up to you seeing the doctor for him to diagnose you, and to some extent, even the treatment he gives you is what we term as primary health care. When it goes further that you have to be admitted or you have to see a specialist, then that goes into secondary. So the primary health care is just your first instance in the hospital, from your vitals to seeing the doctor, to be consulted and diagnosed, and to some extent
in
treated.
your explanation, does it also mean, or does it also include, if it's my first time in a hospital like Kolebu,
No.
and my vitals are being taken and I'm going to see the doctor?
No.
So clarify for us.
So in most instances, this happens at the districts and sub-districts level. So the CHIP compounds, the health centers, the polyclinics. Hospitals like Kolebu are what we term as referral points. Most of the time, you can't go and start maybe you have a headache and you just walk into Kolebu and ask to see a doctor that you have a headache. You can't do that at Kolebu. You have to go to the Kolebu polyclinic, and that is where they will do those things. So these excludes districts, some district hospitals, regional hospitals, and teaching hospitals. But any hospital below that is where you can get your primary health care from.
So if you can go through the list for us for the primary healthcare, free primary healthcare policy that has been rolled out. We know it's available only in certain levels.
Yeah.
And in the health system, there's a primary health level, before there's a secondary, before there's a tertiary.
Yes.
And if possible, there's a quaternary. So with a primary level, we'll be referring to CHIPS compound, as you said, health centers, polyclinics.
Yes.
That pertains to primary healthcare. Where when we say primary healthcare, basic illnesses can be treated. We'll come to the examples of conditions that are treated in primary healthcare. But from thence, then we'll go to secondary. As we said, sometimes district hospitals also function as primary healthcare to certain people.
Yes.
But beyond that, they refer primary healthcare refer to the secondary. Usually, for purposes of this policy, district hospitals have been moved from the primary healthcare level.
Yes.
to secondary, uh, because of things that maybe later on it will come to light for us to know.
Mm,
Yes, but
discuss that.
yes, but um, secondary is usually the regional hospitals.
Yes.
Then from the regional hospitals, the tertiary will be the
Tertiary is the
teaching
teaching
hospitals
hospitals
upward.
upwards.
But for the purposes of
This policy,
free healthcare,
free primary health
primary
care,
healthcare, it is centered mainly in public hospitals. Sorry, CHIPS compounds,
CHIPS compound, health
health centers,
centers, polyclinics,
polyclinics.
health post, community pharmacies,
Yes, they are now adding things like school
school
clinics.
infirmaries. Yes, yes, yes,
Yes,
yes.
and then as you said, community pharmacies, and then
Health posts.
health posts,
Yeah.
which will describe later
Yeah.
on.
Mm.
So, primary healthcare actually is delivering basic health services. And what are some of the health services that people receive on the primary level? Looking at the facilities that has been mentioned.
So on the primary level, you receive services like first of all, I spoke about the vitals. So the vitals includes having your temperature checked, having your height checked, having your weight checked, your blood pressure checked, your blood glucose also checked, and to some extent even your body mass index also um, qualifies under the basic things you can get done.
So that is basic
To,
health screening.
yes, basic health screening, and even sometimes eye tests, eye
Mm,
screening. Yes,
of course,
eye screening also
of course.
falls under that.
Okay.
That's department.
So that's sort of checkups, preventive.
Preventive measures to
Yes,
prevent diseases.
preventive medicine to check yourself regularly. So
Yeah.
you can go there and check yourself regularly.
Yes.
What else? What other conditions do we? So if we want to categorize them well, give them names, we say diabetes screening,
Yes.
hypertension screening,
Hypertension screening,
obesity screening.
obesity,
Okay,
malnutrition.
okay. And then
Um,
vision.
yeah, vision,
Okay. Then what else?
and even with the vision to some extent,
Of course.
yeah, for the eye reading and
Mm,
stuff like
so
that.
it's basic screening.
Yes.
And then from there we can look at maybe treatment for minor ailments
So we
like
can look at malaria,
mm,
common cold,
mm,
typhoid fever,
mm.
what can you even,
And
measles.
these are uncomplicated. Even
Yes,
measles, I think measles is when it comes to vaccination.
yes,
Like
vaccination.
it's also prevention. It's not really as to treating when somebody gets it. They need to refer.
Yeah, true.
So w- w- minor ailments that people will have, on a daily basis can be treated over there.
Mm,
Also, minor injuries. Like
yes,
somebody is reading,
they
they
cut
cut
their
themselves.
legs.
So
Someone falls off a
yes,
motorbike and
if
doesn't
it's a minor,
sustain
yes, if it's a minor injury, then I mean it can be
wound
seen over
dressing
there.
and
And as you also hinted, vaccinations.
yes,
Yes, vaccinations, immunizations, um, pregnancy care
yes, pregnancy care,
is also a basic primary health care. Um,
pregnancy care, and even child welfare services.
those are the vaccinations and
Yes, the
immunizations,
weighing
weighing
and
and
this.
all that. Yes, so
Mm,
all those things are done at that level. Pregnancy care, and as you said, minor injuries
yes.
can be seen at that level.
Mm.
Uh-huh. So this is what the
And
government
I
is.
think one thing we forgot to mention is mental health screening.
Yes, they also have yes,
Yes, mental health screening.
yes. So now when you go there and you seek to get access to any of these any of these services currently assistance now, they will charge you on the health insurance
Yes,
as if you have the card. Otherwise, then you have to
then
pay
you have to pay out of pocket.
out of pocket.
Mm,
Okay. So actually, 80 to 90% of all health problems can be avoided if some of these primary healthcare levels, screenings and things are taken seriously to even prevent the disease from extending to a serious phase where
true.
you get those problems, and for that matter, you have to be admitted in the hospital and things.
Mm.
So that is the reason for which
This
government is
primary
now
health care.
turning attention from curative services and saying that, look, let's try and
Prevent
make,
them.
yes, make primary health care accessible and free. So then that sent us to um, the policy itself. Can you give us, a little bit of insight
Yes.
into the what a primary healthcare is?
Yes. So it looks to give every Ghanaian and legal resident. That's the only criteria that's needed. One, you have to be Ghanaian, or two, you have to be a legal resident if you are non-Ghanaian. So it's providing these primary health services that we've mentioned for free, irrespective you have the health insurance or you don't have the health insurance. Um, and that is what we're saying, that these services would only be provided in some parts of, or some levels of health facilities in the country. Not, you can't, like you were saying initially, you can't walk to Kolebu and say you don't have insurance, but you're coming to hospital,
Take
so they
care of
should
you.
charge you on the primary health, yeah, free primary health care. It's only, I think the main aim for this policy is to make health more accessible to under deprived area or deprived areas, the rural areas. There are some communities that don't have even chip compounds in their community. They have to go, say, the next 2 towns or the next 3 towns. And if you also don't have insurance and you are sick, first of all, taking you to the hospital is a problem. And we going there to go and spend money we don't have to is another problem. But then if it is free, it is of the notion that once we are able to get you to the health facility, you can get treatment. And also, it's looking at preventive or early detection of these diseases. There's a saying that goes, early detection saves lives. Because when you look at some diseases or some medical conditions that we are afraid of, for instance, stroke, if people were checking their blood pressure regularly, would be able to detect early that they have hypertension and deal with it so they don't end up having a stroke. So if these services are free, you more or less don't have an excuse for saying, oh, I don't have money, that's why I don't go to the hospital to go and check my blood
Yeah.
pressure. So government is providing these services for free. That is what this policy is looking at doing, that all these services are free. All you have to do is to walk in and be checked.
Okay. So for the average Ghanaian, what this means is that occasionally they have to go there
Yes.
and it's check who is, how will it be scheduled? Because if everybody also decides that they want to seek the service at the same time, you can see the problem that will arise.
Yes. Yes. So I mean, this is going to be like a normal hospital visit where it's on first come, first serve basis in some extent, or depending on the severity of the person's medical condition. As in, the fact that you were able to walk in, you don't have high temperature, or you're able to walk in and come in and someone comes in unconscious. We won't say because you came first, we'll see
No,
to
but
you.
this is a preventive service.
Mm-hmm,
Okay, this is a preventive service. So we are looking at somebody walking in to check their sugar,
mm-hmm.
blood pressure, get screened, as
Yes.
it were. And we are saying that it's free. So assuming that Ghanaians pay heed to it and decide that, look, because of that, every month I'll go once. Okay.
Yeah.
Every month I'll go once, go and
Yeah.
check. Okay. Maybe I'm jumping the gun. Maybe this is too early.
Well, I think
Maybe when we get to challenges, we'll come back
we'll
to
come
this
back to,
one. So
yes, yes, yes,
let's continue. Maybe I'm
yeah.
jumping the gun. Yes.
Yes.
So if there's a policy, the policy aims at um making routine screening services free. Does it also include breast cancer screening?
Yes. It
So
includes,
any type of screening
yes,
that,
any type of health screening or basic health screening that can be done at these facilities. That is why it is only done at certain levels.
mm,
There are certain health screenings you can't do them at these facilities. That you can't do it at a CHIPS compound or a health center or even a polyclinic. You would have to go to, in this case, a secondary health facility to get these things done. So We are saying that any screening that can be performed at these primary facilities, primary health facilities,
Mm.
they are being done for free.
Okay,
That
so
is basically what this
for
policy is
instance,
saying.
when you are seen at the primary healthcare
Mhm,
level and you are picked, maybe your hypertension is picked
mhm.
or you have a certain level of the
Medical
disease,
condition.
yes,
Yeah.
and you are being referred, and as a free primary healthcare follow you to your
No,
referral site.
no. So that is where the health insurance will take over. So still, it is very important to still have the health insurance because the primary health care only goes to a point. In this context, just primary health facilities. Once you are referred from a from a primary
Primary,
health facility to a secondary health facility, primary health care ends there, free primary health care ends there.
and the
Now, the health
insurance.
insurance will take over at the secondary health facility.
Does it also mean that now those health centers, chips compounds, and all those school infirmaries and things who used to take the insurance now they don't take, they will
No,
not.
they still take the insurance.
So how do we tell the difference?
So the difference is that
Mm,
for the person who has the health insurance might not feel there's a difference because these things that we are saying, the insurance already does it for them. But this is for those who don't have the insurance. The mere fact that you walk into a hospital, you'll be taken care of to a point. It's not everything that would be done for you under the free primary health care.
mm.
So the people that will feel the most impact of this policy would be those who don't have the health insurance. But for those who have the health insurance, it's the usual thing that has is being done for them already.
So does it also mean that now then why will I do the health insurance?
That is because if your condition is more than what a primary health facility can take care of,
Uh-huh.
and you have to come to a secondary health facility, that's
But
when the health
why
insurance
don't
would
I
come up.
see yeah, yeah.
Oh, because the primary facilities can't take care of, or it's not every disease condition that is being taken care of there.
Mm,
There are certain disease conditions, they have their limits. Sometimes, not even sometimes, most of the time, due to the resources they have at that facility,
mm,
the physical resource, the intellectual resource that they have at that facility, there are certain disease conditions they would have to refer
yeah.
to a larger facility.
Yeah, also what they've added, apart from the established chip compound and health centers and the polyclinics that we know, they've also added health posts.
Yes, the health posts, the school
Yes.
infirmaries.
Yes. So in these areas also, the little lights that I want to throw on it is the health posts, for instance. They are designated um sort of kiosks. Yes, it has specific dimensions that they are going to be putting in
Mhm.
certain crowded areas, for instance market centers, lorry
Yes.
stations and things, where you can walk in and access your basic vitals and screenings to be done for you.
Okay.
Yes, so it's like a post where people
Mm.
certain nurses are there. They will do your screening and things for you. If you need a referral, they do it for you over there.
Yes. So even this one, even those who have insurance would still feel the impact because there are certain places you go and you don't go with your insurance. For instance, the market women, they don't always carry their health insurance to the market. It's maybe people that carry wallets and some
Mm.
form of purses are those who carry their cards and everything on them at all times. But for instance, you are going to the market to go and sell, or you're going to the market to go and shop. You might not carry your health insurance there. But once you are being taken to the hospital, or once you are able to get to the hospital, they start taking care of you even before
No, but that
you're.
will not be a hospital. That will be a health post,
Yeah, that's what I'm
health
saying. I'm
kiosk.
saying I'm throwing more light on the health posts
Mm.
that say you go to a market,
Mm.
and in the market you start having a headache,
No, that one is if you want to screen,
or just for
if
the
you want to
screen.
check your
Oh, okay,
BP
okay, okay,
and
okay.
other things,
Mm,
basic
mm,
basic malaria test and things. I'm sure it can
eh,
also be done over there.
mm.
Yes, that's why there's community pharmacies, because when they prescribe for you,
You
then
go to the
you
community
can go to the
pharmacist.
community pharmacy for your medications.
Mm,
Yes, it's interesting. It's an interesting concept because you know, for me when I heard it, I knew that international funding for certain
Programs, health
yes
programs.
programs has gone down,
Hmm.
and especially the immunization and the
Yeah,
vaccinations and things. They used to be funded by
US aid and
certain yes global partners that we had. So I thought it was mainly to bridge that gap,
hmm.
but they've also gone further
Gone.
to include certain screening tests and even malaria treatment and other things,
Yeah.
which is very interesting. But I also want to ask this question: that we know that the community health nurses they usually go on outreach services.
Mhm.
Are those also part of the free primary health care?
Yes, yes. So one other thing this policy is doing is, at first, when the community health nurses they go on the outreaches, the main focus was children. They are going to immunize
So they go
children.
to also pregnant women. Sometimes
Yes,
they
yes,
do their
women,
hypertension
women,
and things.
women, and
Home visit.
yes,
Uh-huh.
but this one is this free primary health care is also going to enable them reach more people, because now when they are coming, they are not looking at just a particular group of people. At first, it was mainly group based: children, pregnant women, and people living with non-communicable
Mm,
diseases like hypertension, diabetes, HIV, and the rest.
mm,
But this time, if the nurse goes for an outreach, and I, who is not in any special group, goes to where they've set up their post or goes to,
to go and
then
check.
she can still take care of me under the primary health care,
Mm,
without me necessarily having insurance or anything like that.
mm.
So this policy is also helping make that possible.
Health accessible
Yeah.
to. It's I think it's quite an interesting thing to
Yes.
understand because I'm sitting here asking myself, how then do they go for their monies?
So I'm sure they would have to raise claims like they do with the insurance.
Well, the little thing that I know is that I think I heard somewhere that it will be pre-funded. The money will be given ahead on time.
But then if the money is given ahead of, so the money will be given ahead of time to procure the medications and the necessary things. So
For
when you
instance,
go
if they
out,
are going on outreach, for instance,
mhm,
they have to buy fuel.
mhm.
Mm, maybe they have if they don't even have a motorbike or something, they have to take public transport.
Yeah, I think that's where the this popular Abubuya ambulance.
Mhm.
Oh, a while back, people were saying the president has brought tricycles to be used as ambulance, but then the government is also saying the intention of these vehicles wasn't to be used as ambulance, but is used to transport medical personnel or health personnel and their logistics to these communities on their health outreaches. So in the tricycles, they have BP machines. It comes, I think, when they give you the vehicle, it comes with a set of some equipment, a scale,
Mm.
um, a meter rule to measure height, and so it's more or less like a mobile chip compound when they go for their
Yes, so
outreaches.
if they are going to post, you are going to raise claims. Doesn't mean then you have to pre-fund it with your own money. Or as I said, I heard somewhere that there will be the money. The money should be released for them
So what
earlier because as far as these outreaches are concerned, you don't
you
you
need
have
the
to
money
yes you have
to
to get
run
the
your
money.
logistics. Yes, 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 yes.
Yes,
So what I'm
and
thinking
report for
would be
it.
done probably would be, maybe in its initial stages, it would be
Mm.
pre-funded, as in money will be released to you,
I've heard from a reliable source that certain parts of it are pre-funded.
certain parts of it. Okay.
Yes, of the policy because if it comes to the screening and things, I'm sure that one they can do post-funding.
Yes.
But when it comes to um
The treatment.
yes, the outreach services,
Mm,
you know, maybe we can look into that and then get
yeah.
yes our audience that response because it's a very nagging question for me. Okay. So I would like to say that most people postpone their healthcare needs, especially their primary healthcare needs. Like your child is sick, child under 5 who is sick, and they have a fever, they are coughing or something, and because they don't have money, they will wait and wait and wait and wait till the child is having seizures. Then they will rush the patient straight to the hospital or to the health center, CHIPS compound, where they are now referred. It now becomes a referral to the district hospital, sometimes even higher, because instead of them to come quickly and seek care, which care will clear the malaria or the respiratory tract infection or whatever is happening to the child, in the name of there's no money, they will still stay in the child and be buying unprescribed medications for the child. So this primary healthcare breaches that gap very effectively, because then when your child is ill, then you have no excuse,
Not
because
to seek
yes,
healthcare.
there's no money except you want to say the government come and pay your lawyer fee to come or whatever. You understand? They should pay you to walk to where you can get help for your child.
Yeah, but I think even in most communities where these chip compounds are located, you might probably even could walk there.
No, there are
Okay,
places
there are
where they
places
are
that
not.
also they are very
You have to
deprived, so
travel.
yeah, you
Yes,
have to go to the
and
next
those
town,
are the
next two
places where
towns.
some of these things are needed,
Mm,
and that is where the health post makes sense to me.
yes,
Because me, well, I don't know, but this health post in urban centers will not make much of a difference, because people who are doing their market and things,
there's the logistics to get you to a nearby hospital.
I mean, there are hospitals all around you.
Yeah.
Do you understand? In
Mm,
urban centers, if you want
mm,
to go, you go.
mm.
There are CHIPS compounds, there are health centers scattered all over the place. But to think that the total mate will occupy kakra and you leave it and go and check his BP, it's an interesting concept over there. But I feel that the hard to reach areas are
Are
the
the places
places
that
that
need
will
the health
benefit.
posts? Yes,
Exactly.
yes.
They are the places that will benefit, because instead of they coming walking miles or waiting for the next motorbike to bring them, then they can easily go
Mm.
there.
I feel like even with these health posts, even if they don't have like a permanent place where maybe the health personnel will live, they could probably come from a nearby place, come
Yeah,
and set
the
up
nearby
there.
chief's compound
Yeah,
and come and be,
come and set up there
Oh,
for.
but they said there will be how do you call it, recruitment to that effect
Okay.
for the health post.
Okay.
My other question to the policy, you see, this policy has a lot of questions because they
Yeah,
are now rolling it out.
yeah.
So
There's a lot of
the
questions
other
to be.
question that I have is, and if anybody is watching that can answer these questions, we'll be glad. But we'll still research and get the
Mm,
answers before we continue.
mm.
Is delivery part, because health centers and CHIPS compound, some do deliveries. They have midwives who do deliveries. Because they say pregnancy care is delivery also part.
So delivery won't be part
Are you sure?
because delivery is not primary healthcare.
How do you why do you say that?
Delivery is not primary
Why do you say that? It's primary healthcare.
healthcare.
It's basic. It's basic. So
Mhm.
I'm wondering. The antenatal fine, it can be part.
Yes.
But
But
delivery,
delivery, I don't think delivery is classified under
we,
primary
we
health.
can we can look at it. We can look at it, because it's very interesting to think that, if delivery is part, then it has to be free for all levels. Oh, because
Mm,
delivery is delivery.
yeah.
You
So it doesn't
understand?
matter if I come and deliver where in which hospital. That's what
Uh,
I'm saying delivery won't be part.
so the insurance will take part of the delivery part.
Yes.
Antenatal
Yes.
will be free primary healthcare.
Yes. So you see, that's why I was saying that this primary health care is not to replace the health insurance. It's to complement the health insurance. There are certain things that the primary health care will do to a point,
Mhm.
and anything beyond that point, the health insurance will take care of it. That's why you still need to get your health insurance.
So this is what it says.
Yeah.
Yes, maternal services are part of the free primary healthcare package, but there's an important distinction to make regarding delivery, labor, and childbirth services. What it definitely includes antenatal, postnatal, maternal and child health care, family planning, immunization, treatment of common illnesses, health education, screening of hypertension, diabetes, and selected cancers, such as breast cancer and
Yes,
so on,
yes, yes.
and other preventive services. This is where you should be careful. I think we should be careful in saying that delivery is part.
So I think what would be part would be normal vaginal delivery.
No, they did not say.
They did not specify.
They did not say. They said pregnancy or maternal health care is part.
Because the reason why I'm saying that is, when it comes to the SVD or the normal vaginal delivery, some of the chip compounds do
They
them. The
do,
health
but
centers
they
do
may
them.
have to charge it on the health insurance. You listen to what
Mm,
the thing is. It says that in Ghana, normal delivery and cesarean sections have already been covered for women enrolled under the National Health Insurance,
okay.
free maternal health care. So you know that with the free maternal health care policy, it's embedded in the National Health Service
Yes,
already.
yes, yes.
So since so I think that
Delivery won't be
it's
covered, but it
under
will
the
be charged
insurance.
under health insurance.
Yes. And you know it is easy to do health insurance for
Yes,
pregnant women.
yes, yes.
So I beg you, if you're a
I
pregnant
mean, if you're a
woman,
pregnant woman,
get your health insurance done. So the pregnant women, please keep your health insurance active. Or the moment you realize you are pregnant, go and do your health insurance, because when you are going to deliver, it will not be free primary health care anymore. It will
mm,
be health insurance.
mm.
So at that point, if your health insurance is dead and you have been surviving on the free primary health care for
Now
antenatal,
you have to pay out of pocket.
now very hot too. That's how it's going to be. So
Yeah,
I think it's a very important distinction we make,
yeah,
because there's free maternal health care and the health insurance,
yes.
where I think they don't even pay premiums. Once you go there, they'll do it for you,
Mm,
and then you come, and then you
mm,
come and continue antenatal. But to your delivery, but for the free primary health care, they say maternal health care. But I'm suspecting it's antenatal, postnatal, all those things, child
yes,
welfare.
yes. But the delivery in itself won't be covered. So if you are pregnant, just get your health insurance done.
Right,
When
right,
you
right.
deliver, to get insurance done for your child. Because I think that one is also free. The newborn babies.
Oh yeah, yeah, yeah,
Yeah,
yeah. It's free. It's free.
yeah, you just get insurance.
I think that leads into our next question.
Mm.
And I think we've already answered majority. How is it different from the health insurance?
Yeah, so it's different from the health insurance in the point that the free primary healthcare policy only covers primary healthcare.
It's
Anything up?
actually, you see, look at it this way. It's actually preventive care.
Yes.
Okay, maternal care, preventive, all preventive services,
Mm,
immunization, health education,
yeah.
screening, and all those things.
Mm,
And then management of minor ailments.
yes.
That's what this policy is covering. The rest is insurance.
Mm.
You understand?
I mean, left to me, I would have even preferred that this free primary healthcare thing is given to only the deprived areas.
Oh, why?
Because
He
I
said
mean, in the
universal coverage. So right now, universal health coverage, that's what Ghana is trying to achieve by making this policy.
mm,
So it has to go everywhere. If you say they should put more emphasis on
okay,
the
yes, more
hard
emphasis
to
on the
reach area,
deprived areas. More emphasis on the deprived areas, because
well, I think that we foresee some issues.
mm,
You know, some issues. The problems that will come when this goes into full gear. Currently, they are in, I think, 160
yes, once you
districts.
see districts,
Yes, and then they are trying to see how it goes.
yeah, by
Mm,
next year they'll try and cover more
We'll cover the
districts.
whole country, I think.
Mm,
Yes, but the question that I'm to ask is, as it speaks now, if you go to a say chef's compound and health centers, the kinds of facilities that are available Okay, the kinds of things that are the glucometers,
Mhm.
equipment, their weighing scales and other things that they will use to do these things, their BP apparatuses. Once people buy into this free healthcare policy idea and they start turning up, do they have the
Are
numbers?
they going to be enough?
Do they have the numbers of personnel? Maybe it's one community nurse, one midwife,
Mm,
one enroll nurse, three-man post. And now people are coming. They used to see maybe 10 cases a day.
maybe. Now you're
Now
seeing.
70. The pressure that is coming on the district
Yeah.
hospitals, because this place is practically free.
Mm,
Everybody is now going there first
yes.
to go and get all those screening.
Yes.
Not particularly because they are sick.
But because it's free.
No, because they said prevention.
Okay. So they are
So
trying to
why am I preventing? You understand? If it's coming to prevent,
Mhm.
and now the people are there are now stretched. The facility, the equipment that are available are also stretched,
Mm,
and then some will start becoming faulty and things.
mm.
They too, they are not allowed to chat. So I think that
I think that's where the recruitment you are talking about would also come in, because they would also have to benefit from those recruitment, as in get more personnel to those areas and those health facilities. Because I mean, if, like you were saying, there's three of you seeing 10 patients a day and now there are 70 people, that's a way
I'm
over
looking
the
at
top.
it this way.
Mm.
Maybe this one, I don't think it should be a national. In that case, they should schedule, because you see, in certain area places, they schedule you for routines
Your clinic visits,
visits.
yes.
So if people start turning in, they should schedule, because this is not an emergency
Mm,
thing that you must come giddy, 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 giddy. Like the way they schedule the antenatal people every
yes.
month. So if the first time you come and you register and everything,
If
then they
they
will give you
schedule
the
you
next
for
day
the
so
next
that it
time
will be
you'd
10,
come.
10, 10, 10, 10, 10, 10.
Mm,
Then your workload
it's
doesn't
spread
really
out. Yes,
increase.
yes,
Every
yes.
day you are sure that 10 people will
Yes, would
come, that
come
you
and you would,
yourself,
yes, yes. Yes, I think that's would I think they even do that for the usually
diabetic,
the diabetics
hypertension.
and the hypertensives, they schedule them. But yes, this one too would also, as in, once you
Because this is
come,
screening mainly, and even the weighing people, they schedule them.
yes,
So they can look at it and see how best. Because I can imagine that, but you see, that does not answer the question of pressure on equipment.
because if an equipment is doing 70 people a week and now
it
it's doing
it may
like,
break down.
yeah, it
The
would break
battery
down.
will run down,
Yes.
and then so I think, um, I've heard that government has done some procurement towards this policy in trying to implement it. Government wants to spend more money to
Mm,
equip, you know things
the
like that. So yes,
facilities.
and I think it should go before
The
the
policy
policy
rules
has
out.
already started. So maybe when they start running those policies, uh, as they start doing it, they will
Yeah.
pick those issues and try and fix them before they go to the next phase,
Mm,
because it will come. Yes, it will come up when you know people go on leave. If you are three and one goes on leave, the other thing that goes without saying is how soon will the people get their money? Because this you are opening the floodgates, telling
yes.
everybody to
To
come.
come.
So the situation where their BP apparatus is broken down, glucometer is fault, or the strips are used up, and the
How
funds
soon are
are
they
not
getting their
coming.
funds? Because if this is also going to be like health
Hey,
insurance.
it's diabetic. Be careful, oh, health insurance will come for you. If it's going to be like, yeah, it's going to operate like health insurance where they are paid at least
I mean, it
three
would,
months or
because
after.
part of their money, of the money from the information that is there, part of the money for this primary health care is
It's not a
coming from
part.
health
It's a
insurance.
whole
The
money.
whole money is coming from.
Because health insurance is the way they pay health
Mm,
bills
mm,
to the facilities.
mm.
So it will be, maybe it will be a different approach.
Okay.
Maybe there will be a different approach. But
Mm.
as it stands now, if they are going to do that 3 to 6 months, sometimes 1 year payment.
Mm,
To stifle the policy. Implementation will be a problem.
yeah,
You know, it will be
that's
hard.
that is true.
The other thing too is part of the implementation that I think could be a problem is the facilities themselves, the building in itself. Some health centers is just one
One structure.
yes, without accommodation and other
Mm,
things
the staff have
available.
to come from
Yes, they are
other
somewhere they have
places.
to come, and you see, if you are saying somebody should walk in and get seen, and they come and they are yatum because the
Yeah.
person has to go. Yes, the
Mm,
place is locked because the
mm,
person has to go to the next 2 towns to go and sleep and come the next morning.
yes.
Close at 4.
And even because it even has treatment of certain minor illnesses. I mean, malaria could present very aggressively. Like you could have a splitting headache,
Mm,
which maybe you need some paracetamol to make you feel okay. And say in the middle of the night you have a headache and you go to the chips compound or you go to the health center and nobody's there. So I think that will also have to be taken into consideration, which
mm,
still falls back to recruitment of more people so that they
yes,
can run
they have
the
to.
shift the
They
shift
have to do.
system over
They
there.
have to because shift system. You
Yeah, they
see,
would.
the problem is
Mhm.
some of the places are very deprived. Some of them are very deprived, and even going there, we have network. You understand? So if
Mm,
yes,
so
how
you
are
can't
they?
stay there.
Yes. Oh, they can stay. Some have accommodation, others don't. And so it's like a health post. So you go there, and then when you close, you
You
go back
come back
home.
home.
So in that case, hmm,
I think these are some of the challenges that after it has been ruled out or after the policy has been out for a while, these are some of the things that would have to be evaluated and solutions found for them,
yes, and
because
then
it brings in a whole lot of new problems that, I mean, you're trying to fix a problem, but your answer to the problem is also bringing up new
hmm,
concerns that you have to.
definitely because anything that is started like that, the problems will now become
So you'd have to evaluate and reassess and see
yes, 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 yes,
how
yes.
how best you could solve those issues
They will be refining it as.
as it goes.
I think one thing that also has to be made clear is they have to make clear the criteria for referral.
Yes.
It has to be clear. You have to
Where does the primary healthcare end?
exactly.
Mhm.
Otherwise, then what we will be having is that people will be keeping cases that they should be referring.
So I think one thing about this policy is also that it doesn't take care of admissions. It doesn't even take care of detentions.
Mm.
Uh-huh. So if you have a case and you have to detain or admit, that is a clear indication for a referral.
Yeah, they have to make it clear because if it
Uh-huh.
comes to the policy guidelines and everything, then if you go and you do something, then it means that you are
You
doing
incur
it on
that cost,
purpose.
yes.
Yes, yes.
You incur that cost. And also, I think there should be, yes, they've said it to the public, but the people implementing or the people providing the service would also need some form of workshops to
Oh
help
yeah,
them
definitely,
understand.
definitely. I'm sure
Yes.
they do that. They are doing that
Mm,
as the district that have been choosing to be.
to start them.
Yes, I'm sure they've done that for them.
Mm.
So the next question is what are free? Is it consultation? Is it laboratory? Is it medication? Is it what exactly?
So, what is free? Yes, consultation is free. Checking of vitals, the primary health
Mm,
screening, your BP, your
mm.
glucose, your blood glucose,
Oh, but those ones they
your.
said they've been free. Or people charge for it
I mean, if you go to a
just to check it.
hospital without, yes, without insurance,
Okay,
you pay for
I
those
see.
services. They charge it as part of the consultation
Mm,
fee. Yes, so those things are now free. And certain laboratory investigations, especially the ones that are done with the rapid diagnostic test kits. So with the malaria, the typhoid, the pregnancy test, the HIV test kits, those ones.
No, but those most of them are HIV. I know it's free. Yes.
But malaria isn't, typhoid
Mm,
isn't.
yeah.
Yeah, so those things are also now free. And I mean, when it comes, there are certain conditions you would not even like bronchitis
Those
and
ones, do you think they will pay for it over?
no, they won't. I mean, you need a full blood count. A full blood count, you need machine
Mm.
machines.
Is it also part?
No, I don't think so. I don't think those are parts. Those would fall under the insurance. Those will fall under. That's what I was saying, that the people that will feel the most impact are people that don't have the insurance.
Okay.
Because if you have the insurance, all these things were free for you already.
Mm.
So, but the people that don't have the insurance would feel the impact, which, according to statistics, is a lot of people. About 34% of Ghanaians don't have
I'm not
insurance.
insured.
Mm-hmm.
Actually, it's not just Ghanaians, it's Ghana residents.
Yes, residents,
Mm.
yeah, people living in don't have the health insurance, and that is so. The policy is mainly targeted at those people so that they can still get healthcare irrespective not having the insurance.
I want to check something. So you give me a minute.
Okay.
I can see you are enjoying the video. Before we continue, I'd like you to subscribe to the channel if you haven't already. Please share with a friend, family member to help our channel grow. Comment, know your feedback on the next topics you would like for us to discuss, that we can create better version of these contents for you. Get back to the video. Okay, let me. So I asked that will it be pre-funded or
Yeah.
to be post-funded? And the answer that I'm getting is that yes, at, at least in principle. So we are yet to see whether it will actually be
Yeah.
pre-funded. He says that pre-funded health system means that the money to pay for healthcare is collected before the people become ill, rather than when they need treatment. So what I'm gathering is, it's intended to be pre-funded. Yes, government officials have stated it that it's pre-funded. So maybe when the budget is right, it will allocate an initial amount of money, which will be
And would be.
shared across board to them.
So what happens if your money runs out?
No, I'm sure they will have to be sending.
Reports for the money, that this is what we've used the money
Yes,
for so
they
far.
will have to report one way or the other. Because
So that when your money finishes, they can top
usually
you up.
with the how do you call it, the donor funds, that's how they do it. They give
Okay.
them the money,
Okay.
then they
Then you come and
report on
report
it.
on the money.
Yes. So it says government officials have stated that programs will be financed through an existing NHIS resource with an estimated annual cost of 1.2 billion Ghana cedi, and that no new levy is planned for the program. So it's a pre-fund. Government will release the money. There are several possible payment mechanisms: capitation, fixed amount per registered person,
Okay.
free fee for service, payment for each service delivered. That is what we are talking about. Diagnosis related payment. That's what I'm thinking. That's what the insurance does now. Payment based on
The
patient's condition.
condition.
Global budget, a fixed amount allocated to a facility.
So that's what I was going to ask. That so if it's pre-funded, does it mean every facility gets the same amount of money, or they would say, okay, health center A is in a community with 50,000 people. Health center B is in a community with 20,000 people. So let's give the one with the 50,000 much more money than the one with 20,000.
Well, we don't know. Because it's not everybody who will need that
That's,
care too.
yeah.
Okay, you can also have a mixed payment system where you mix one or two of. whether
Mm.
capitation,
Mm.
fee for service,
Mm.
diagnosis related,
Mm.
global, whichever way. But
Mm.
I mean, it's important to state because the some of the services you can't say you should pre-fund it and then you
Yes.
pay later.
Yes.
That one it won't work.
Mm.
So I'm sure, as has been said, it's pre-funding. There will be budgets made. Maybe what they can do is maybe they'll caption what will it entail to do a hypertension screening.
Okay.
You understand? And
Okay.
then maybe they probably might have done some research, and then they will do it. If you are
Mm.
going for um, an outreach,
How much will
very
you need?
far, nearby,
Mm.
intermediate.
Mm.
So I'm sure those things,
Would be taken into
those who are practicing
consideration.
it now will know it better.
Mm.
For us, yes, we know it better, and in fact, they should try and put it in the comment section if they are watching.
Mm. Mm.
Educate us on how the payment
Of these
will
things
be
are
done,
done.
because
Mm.
as we are being told, it's pre-funded. It's important health um, facilities know how they are going to get their money,
Mm.
because I'm sure there will be, when they come, you generate some codes and things
Yes. Yes.
to
One
verify that
time.
the person has been there.
Yes.
Uh-huh.
To prove that you've actually
You take,
seen
maybe if
this
they don't have
person.
insurance, you take their Ghana card or something.
Mm. You'd have to verify them one way or the other. Speaking of the code, I think there's a short code provided to be able to create the code, or we should leave that till when we are closing, when we are wrapping
Yeah,
up.
when we finish, we'll go through the particular document
Mm.
for the primary healthcare, because most of us have all we have are questions now. So we'll look,
Yes.
and then maybe to answer some of the questions
Yes.
that we have.
Mm.
Okay. Yes, I mean, as people who work in district hospitals, I think we see a lot of cases where could have been prevented. As you say, certain strokes, if the people don't have to come all the way to the district hospital for the antihypertensives,
Mm.
and they can just walk to a nearby chief's compound health center and get sorted out, I think it would have prevented a lot of comorbidities, a lot of serious conditions, as I described earlier. Malaria,
Yes.
simple malaria, go and
Yes.
treat the case. The person will not go
Wait till
because they are not the
convulsions.
one feeling the pain.
Mm.
It's because it's the child. They will wait until they see a seizure.
Mm.
Sometimes they will even send the child to the market,
True.
and then the seizure will happen there. Then then rush it over there. So
Mm.
I think the free, primary healthcare policy is good in principle.
Mm.
The other thing that we need to also bear in mind is that, is this policy going to be accepted by the people who it has been designed for? Because last time when we were discussing this health funding situation, I said the people who need health
Insurance
insurance,
don't have the health insurance.
this is the service is now free. Are they going to be taking the screenings as they should, or they will wait until now they need health insurance and they still don't have you know acceptance of the policy, and I don't hear the noise around it.
About it. I think for a lot of people, to them it's big English that the government is saying. They are saying free primary health care. But
For most people, it's like the same free healthcare that they are. Meanwhile,
uh-huh,
I'm also at the P.
the education is not going down for the people that is meant for them to understand that. I'm sure there are people who still don't even know that now if I go to the chips compound and they see me, even if I don't have insurance, it's free.
No,
Because
but it's not everywhere. So let's make it clear. It's yet.
no, I'm saying even with the rural areas
Mm,
that have them, because I've seen like videos online where government have sent tricycles to
mm.
certain chip compounds and health centers. So I presume in those chip compounds it has started. But I am sure there are people in that community that don't even know that there's a new policy like this.
There's no much noise
Yes.
about it. Once a while, you in the health center, once a while, you come across something on it.
Mm,
Like the way when the insurance came, it was loud, it was heavy.
yes, they were.
Maybe after that, piloting,
Okay.
maybe.
Okay.
Maybe
Okay.
after the piloting, they will make that
Because
move.
when the insurance came out, there were vehicles. The NCCE was doing education,
Yes, for their
but
registry. This one you don't need to register.
I think
So
this one, the biggest noise that was made about it was about the tricycles being ambulances, not being ambulance, which I think took focus off what the policy is meant to do. It became, people turned it to more of a politics thing than
yeah,
understanding
but it's
the
a political thing. What are you talking about? It's a political thing.
understanding. That's why I'm saying you've brought tricycles for people as ambulances. So I say, oh no, it's not ambulance. It's this one. I say you can also give people. So there,
Yeah.
if to me, I feel like the education is not going down well.
That's what I'm saying. Maybe it is because it's in those
They are now
selected
piloting.
area,
Okay.
yes, side
Mm-hmm.
of thing. When it becomes national, maybe we'll see more,
Mm.
infomercials about it.
Hopefully, hopefully, because this is a very, to answer the bigger question of whether Ghana needs this. Yes, Ghana really needs this, because when we prevent a lot of these diseases in the long run, it takes pressure off our health facilities,
Yeah.
because people don't get to that extent where they need that health facility to be there in the first place.
And it actually maintains your productivity. If your people are
Are
healthy,
healthy, yeah,
they
they are more
produce
productive.
more,
Yes.
it reduces, as you said, pressure at the government. It
Mm,
reduces pressure on family members.
mm,
Now you have a mother or an old lady who has a stroke. Now you have to stop your work and go and sit by the person
yeah, take care of
and take
her.
care of the person. Now I think all your other siblings should be sending money to you for this and for
Financial
that,
strain. Yes.
physio here and there. So all those things can be avoided.
Yes. And even the sad part for especially stroke is that the person most likely won't become 100% how they used to be. There
Mm,
would always be
exactly,
that
especially if it's an
deficit.
old person.
Yes.
It's a sort of a almost permanent damage
Yes.
on the person.
Yes.
And the hospital stays are lengthened for so many
Mm,
days and weeks.
mm,
And then the pressure builds up. So if and sometimes when you go to our OPDs, majority of the people you see there are people coming for routine medication. There's
yes.
nothing wrong with them.
Yes. Yes.
But having said that, if you are transferring that pressure to the health
To the
center and
health
the chief's compound,
centers.
then the facilities must be upgraded. The facilities, the human resource
Mm-hmm.
challenges must be answered,
Mm-hmm.
and strengthened, so
Yes.
that it's not like you're pushing the people there and a few people are going to be suffering.
Mm,
That also brings, a certain level of apathy, and because your salary will not increase.
mm.
You see,
Your workload will increase, but your salary
a
will remain the
majority of
same.
our health personnel, they are in these big hospitals.
Mm.
The doctors in Golibu alone, who they
Yes, true.
distribute it across the whole country. You
True.
understand?
True.
So if they seek to make this a thing, I think it's more of an attitudinal change.
Mm.
Yes, we should preach attitudinal change. At least once in 3 months, if you're above a certain age,
18 get screened,
go and get screened. That is when people will actually use it. Otherwise, the availability is there.
but people won't be using it.
People will not use it. They
People
would
even boast of not visited the hospital in a very
the
long
whole
time.
4 5 years they have not gone to the hospital because
Yeah.
they don't feel any pain anywhere, no
So they
discomfort.
think everything is okay.
So for them, their body is perfect, they are strong. But it will just take one day for you to be reminded that
How
you are a
fragile
mere
your body,
mortal.
how fragile your body
Exactly.
is.
We are not as strong as we may think
Mm.
we are. So I think, we should all throw it behind it. When it comes to your district, embrace it. But what we have seen before is such a well-intentioned policy coming on and then being stifled by some of the challenges that we have mentioned,
Yes.
or even some that we have not envisaged here,
Yet.
because funding. They said they will be using some NHI levies, some
Yeah.
taxes here and there to fund this, because some of the global donors and things, they have withdrawn their funds.
Mm.
And I think it's a lesson for us because and we cannot be in this country and our health is being taken care
Dependent on other
on
people.
by for somebody.
Yes.
Then they owe you. They own you because the moment you realize that they realize you are going in a way that they do not, it will not benefit their people.
They
Then
try
they
and
pull it back
yes.
to in order to control. So I'm very proud of the current government for standing their grounds. Okay, they couldn't have done anything.
I mean, so I don't know how true it was, but then there was also another news that they said they were going to give us an amount of money, but in return they needed our health information.
Yeah, but I think that is a different conversation.
Mm,
Yes, when Donald Trump came into power, according to him, US was in a lot of debt that he had to cut off some of the grant programs that they had across the whole world. It's not just Ghana.
mm,
So some of those things were taken off. And I think this sort of fits into that gap quite uniquely.
okay.
And then sort of goes a step further. So if you are able to maintain it, it will help. I mean, it shouldn't be optional. We
Yes.
should maintain it. Even if some of these screening things and things are not really accepted, it will help us in our immunizations,
Yes.
vaccine procurement,
Yes.
and all those child welfare things. That is very critical because funding has stopped because we're solely dependent
Dependent on
on
other
foreign
people.
donors.
Mm,
Our children should be our responsibility.
yes.
The health of our children under 5 and everything should be our
Should be our
responsibility.
responsibility.
Yes, that's what I think. And I think so far we've not seen any change in that area. So
Yeah.
the government is doing quite
They've
well.
absorbed it very, very
Yes,
well
very
that
seamlessly.
mm,
Huh.
you wouldn't even
You
know.
don't notice.
Mm,
You understand? You don't notice that there's any such hitch in this. I was watching it very carefully, but it looks like the vaccines have been coming.
yes.
But let's see how this program pitches, itself in that system because we have some of the very good vaccine systems,
Mm-hmm.
globally,
Mm-hmm. Yes.
especially when this COVID and thing came.
Yes. Yes.
Okay, so we'll look at the small information that has been designed on this free primary healthcare. Take you through maybe some of our questions will be answered,
Mm,
and then we'll call it a day.
okay.
So free primary healthcare, health without barriers. Introducing free primary healthcare for all Ghanaians. A bold promise from the government of Ghana. Essential healthcare free at point of care for every citizen, every resident, regardless of insurance status. Free primary healthcare. What is free primary healthcare? It's a national policy that gives every Ghanaian and legal resident access to essential healthcare services at the primary level at no cost at the point of care. No insurance, no problem. You are covered. Asemo. Available at CHIPS compounds, health centers, public health units of polyclinics. So this one
It's not even the main polyclinic
raises a
itself.
question because in this information that they've given is public health units, which is the child welfare,
Yes.
family planning,
Mm,
I think antenatal and postnatal. That is
yes.
mainly the what entails, and there may
Mm,
be some other outreaches. Yes. So
I,
this
I think
one,
there's some this thing have their skin
yeah, oh yes, 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 yes,
under the
yes.
public
Those are
health.
communicable diseases.
Yeah.
Yes. And then I think they want to add wellness clinic to it.
Mm,
Huh. So this one, I think clarification is needed. Does it mean that the other side of the polyclinics are not the curative part is not part that one should be
yes.
covered by
I'm sure
insurance.
that's what it means.
Then there's health post, which is a new concept that's been introduced.
Mm,
The one that I'm particularly impressed about is the school infirmaries.
yes.
Because school infirmaries,
From time most of these ones. I mean, way back in school, there was a thing we used to say sick bay the
parade,
will be a
and then if not, they will send you to.
Yeah.
Yes. So if your
Mhm.
child's NHIS is dead, then trouble. So
Mm,
the school environment should be is a very good because the student doesn't have even he doesn't even know if they try.
yes.
That's simple.
Yes.
They have to
Now
be
they don't even
calling
know where
parents
their
up
card
and down.
is.
Exactly.
Mm,
So it's a good thing. And then the community pharmacy.
yes.
Now, why now? Sorry. The
Mm,
question is why now? Because that's 4% of Ghanaians are still not insured. Despite over 2 decades of national health insurance scheme, many Ghanaians still face out-of-pocket costs that stop them from seeking healthcare. The results: worse health outcomes, preventable deaths, free primary healthcare changes that permanently. That's right.
mm,
The policy is designed to remove financial barrier to basic health services, promote early diagnosis and preventive care, rural reach rural, unserved and underserved communities, expand service delivery through pharmacies, schools and health posts. What services are free? Phase 1 services. Adults 18 plus annually. So another question is
does
this
this mean you can only go once a year?
exactly.
Does
So
this annually mean?
you get one annual checkup. Is that what that means? We need clarification on this one.
No, I
So
think they said phase one, so
no,
maybe
this is for they are rolling it in two phases. This is for
the
the pilot
yeah the
phase.
160 districts.
So what said they own it soon the code. So this annually there is makes it very interesting. It means you can't just be going there for the
Every
sake
time
of
you are
going there.
sick.
Okay. So breast cancer screening, physical examination. So those ones are free.
Mm,
Blood pressure check free. Glucose testing free. Body mass index assessment free. Non-communicable disease risk counseling is also free. Mental health screening. So this is for adults.
mm.
You don't see any malaria treatment. I said, "Oh." Okay, so this is where okay, let me read it. Let me not talk plenty. For children and young people, vision screening for infants at the child welfare clinics. Health checks for children age 4 to 18. Vision, dental, mental health, and skin. Referral for hemoglobin electrophoresis. Newborns of sickling positive mother. So if you have a newborn of sickling positive mother, you have to check the
Mm. So
electrophoresis
does
too.
it mean if you are referred to the secondary health facility, the test
They will
itself
refer you
is
to a
free?
health center where you can get it.
Oh, okay, okay,
Uh,
okay.
so this thing is saying something totally different from what we
Yeah,
believe.
what we're thinking, what we're
Hey,
thinking, this policy is
no,
so.
hold on. But the research we need to give us,
Mm,
let's continue. This is according to the information, as you can read on your screen.
mhm.
Who qualifies? All Ghanaians and legal residents qualify. No exceptions, no income thresholds. It now makes a lot of sense. No
Yes,
insurance requirement because
yes,
these things are essentially free. They are
mm,
all services.
yes.
There's no
No,
medicine.
no products.
Interesting. What do you need to bring? NHIS card or Ghana card for identification. OTAC, a one-time attendance code for curative services. So there's curative services
Mhm.
is part. So we are not wrong.
Yeah, I'm saying this is talking about phase one, which means there will be subsequent
Okay,
phases
okay,
to it.
okay. Makes sense now. No ID. The facility will use NHIA approved verification process. You will not be turned out. So once you go there and you don't even have the card,
Mm.
you'll be able to access.
So it means even for the one-time code, it's only needed for creative services. So,
Yeah,
so
yeah.
it means if they are
So
only
if you have
providing
some
the
malaria,
screening and there's
they
no,
don't need that one.
mm,
Okay, so then I understand why it is pre-funded.
pre-funded,
You understand?
because you don't even need a lot of money to provide a
Yes.
lot of the things they are
Yes.
they are
No,
asking you
once
to
they have to
provide.
come in and pay for medicine and other things, then you need that code.
Mm,
Okay. Who qualifies? How to use the one-time attendance code. Dial *292#.
mm,
Select option 5, OTAC portal. Select option 2, generate OTAC for FPHC. Choose for yourself or a third party. Enter your free primary healthcare ID, biodata, or Ghana card ID. Healthcare comes to you. Don't always you don't always have to go to the facility. Community health nurses will visit homes, run outreach programs, and bring basic screening directly to your community. What happens at a visit? Blood pressure checks, sugar test check, BMI measurement, physical examination, health education and counseling, referral for further care if needed. Some services will find you, not the other way around. Free primary health care rolling across Ghana. Phase 1, starting April 26. It means
mm.
it started already.
Yes.
160 districts. Services available at CHIPS compounds, health centers, polyclinics, school infirmaries, and health posts. Phase 2, expanded to cover the remaining districts nationwide. Full nationwide coverage 2028. Every district, every community, every Ghanaian. Free primary healthcare works with NHIS, not instead. So free primary healthcare is equal to prevention.
Mm.
And then national health insurance scheme is
To go
equal
to
to
treatment.
treatment. So free primary healthcare focuses on catching problems before they become serious through free annual screenings, early detection, and community education. So
Mm.
that is where the focus is. NHIS continues to cover hospital admissions, surgeries, and treatments services. Together, they give a Ghanaian full spectrum care. That makes sense. Important clarifications. Hospital admissions and surgeries remain under the health insurance arrangement. Free primary healthcare does not replace health insurance, it extends the coverage floor. NHIS premiums will not increase because of the free primary healthcare. Funded by the state, built for you. This is where the political. Free primary healthcare is funded through a combination of
NHIS
NHIS
levy.
levy, SNIT contributions, government budgetary allocation. So if you are not on a SNIT contributor, that means you are cheating the system. Those of you
Yes,
who are
yes,
not
who
in the
are not paying,
former,
who are not paying
they
your
are the
SNIT
ones who will not
contributions.
even do the insurance. The,
Those who are paying are the ones who won't enjoy these
they
things.
will not even go and do the screening.
Mhm.
And they even have private.
Private insurance,
The problem is designed.
the
Sorry,
program.
sorry. The program is designed to remain financially sustainable. Are you? No new cost to the public. It's implemented by Ghana Ministry of Health, Ghana Health Service, CHAG, Christian Health Association of Ghana, and National Health Insurance. Now, is private facilities part of this free primary health?
No.
Question for the gods. Question for the
No.
gods.
I
Because
mean,
there are
given the
private there
criteria,
are private health centers.
well, yes,
There are
but
primary maternity homes.
okay. So then I
So
think some of them, because they are private
right now
facilities
they
where
didn't
they are not.
mention no. They
So
say CHAG, Ministry of Health,
because
Ghana Health Service,
I
then
know
NHIS.
certain communities where they don't have a government health center or a government
Uh,
chips come, but there's a private
uh,
one there.
so now I have to go for the government one. I have to ask them.
Aye.
Government is trying, but it is what it is. But your part is in making it work. sorry, your part in making it work. Free primary healthcare is a right, not a shared responsibility. Sorry, and a shared responsibility.
Mm.
Hey, I'm making mistakes. You can support the program by going for annual screening. Please, we beg you. Go and get screened for free. Go. Don't let this fail, because if it fails, it fails for everybody. The ones
True.
who can pay and the ones who cannot pay.
True.
So once a while, walk in there. They say if it's once per year, go and get it done.
Mm-hmm.
But what about the clinics rather, or the primary health facilities organizing screenings instead?
I think if they organize screenings, that would,
Once a while.
well, that would be the outreaches.
Oh, in the facility. Once a while.
Mm.
For this particular primary. Because if
Mm.
people are not coming, and then you do something like a
Health screening to
at the
get
facility,
people.
you make announcements and you tell them that they can walk in. I think that will help
Yes, yes.
by way of community engagement.
Mm.
I think that will help. Anyway, so go for annual screening. So it's annual screening.
Mm. So it
Like,
means once
it's not that
once
you can go multiple months. If you want to go again,
where do we
you
have
pay.
insurance?
You pay. Okay, so you can go for annual. Keep your NHIS membership active so that you can be covered whichever way. Follow medical advice given at your visit. If they say go for your a referral because your BP is up, please go, so that this will prevent preventable comorbidities. Using services responsibly, masa sawati.
Yes, it's free tea. Every
Responsibly.
week they announce you.
Don't go and create problem for the people over there. Use it responsibly.
Mhm.
Encouraging family members to also get screened. Don't abuse the system, otherwise then it will
It would
fail.
break down, yes.
The healthier each of us stay, the stronger Ghana becomes. Finally, your health is a right, not a privilege. Free primary health care policy is Ghana's commitment to leaving no one behind, regardless of where you live, what you earn, and whether you have insurance. And then there are contacts if you have any questions or suggestions
Mm,
for the
I think we should also contact them and channel our questions to.
they should find our content and answer our questions. If you have for the implementers, the questions, their phone numbers are there, their
Emails,
emails are there,
websites, even a WhatsApp number.
WhatsApp is there for any NHIS.
Mm,
So you can get into contact with them. At this point, I think we can call it a day here.
mm,
If you have any answers for us, any questions, put it there in the comment section. Share it, give us a thumbs up. This helps us to create a very, this gives us the visibility online first, pushes it out to more people so they can see, and it gives us, the encouragement that we are doing a good work. So I
yeah,
will
to
come
do
and sit
more.
here, come rain, come shine, and give you the best content that you need in the health system sector in Ghana.
Yeah.
This has been our board health for today. Bye.
Same time next week.